Welcome you all back to another episode of the Healthcare Dialogue series. Today we have Dr. Chatchai Arthur Yachantha. He is the Division Director for Patient Experience and Engagement Services at Bumrungrad International Hospital in Thailand. Bumrungrad International Hospital is one of the world's top choices for medical tourism. It is the first hospital in the world to be awarded Global Healthcare Accreditation certification of conformance with COVID-19 guidelines for medical travel programs. We'd like to congratulate the entire team of Bumrungrad to achieve this privileged certification and for its unwavering commitment to patient safety. So, Dr. Chatchai, the other day I was actually reading one of your recent posts that said if smiles are the symbols of CM, safety and healthcare hospitality are the symbols of the patient experience in Bumrungrad. A very well laid thought in words, I must confess. Keeping patients at the center of healthcare is what every healthcare provider envisions. So please share your insights on what strategies or initiatives did your facility adopt in order to protect and preserve patient experience during and beyond the pandemic.
Okay, thank you for the questions and hi to all. Um, for the initiatives or the key strategies that we use in Bumrungrad International is the first one is to create the safety concern and also the safety environment for the patient. At first, we did the screening desk with the thermal scan, but because that we have to control the mind and also the panic of the things, we know that there was no case in us at first place, but based on our experience in SARS and MERS in the recent years, we have already prepared the screening questions, the screening desk, which actually we put into we call the cultural desk, where we also screen those who come from other countries. And on first, what we do is we believe in agility and caring. So what we use is we use a thermal scan to do. And one of the very interesting experience that we found is because it's automatically screen and or scan the temperature of like maybe 10 to 20 people. On the other end, the patient feel unsafe of having the thermal scan because they don't know their own temperature, and they actually they at the end of the day they request that we should have something that tell them what is the temperature, what is their temperature, and they can see by themselves. So they actually this is one of the good experience that we have tried. So we were on wrong and right. Like in many steps, and one of the thing is we push the entrance into the closest gate. So we have like the single gates get in. We did also the control even the traffic. Means that when you park the car, and in general you get up and down in the same elevator, we control the elevator just to have one single way. So one single elevator will go down only, and the others go up only. And then we control the place of the screening registrations, and we redesign the whole thing of the patient experience and patient journey to make sure that first of all they are not waiting in the long queue. The second one, they are very distancing to each other, and at the third one, they work in collaborations to collapse some of the unnecessary function, lean out, and then we put on some more of the satisfaction on the way. However, I mean, of course, at the end of the day, there will be some of the patient who rush to see the doctor without any concern of safety. But what we stand still is also the concern on safety. We have the separated elevator for the high care patients and also the immunocompromised patient. For example, those who are very fragile, the young baby that come for vaccination. We also separate the wings and also separate the pathway. So that's it's going to be extremely clean pathway, and we cannot claim that the whole building is COVID free. But what our goal at that time, I think it was about 4 5 well actually 9 months ago, that when we start since Wuhan outbreak. On day 2, after the news, we set up the screening Yes, right away. And by that time, until this time, we also do the separate elevators. We have the separate settings of the clinics where we call the special clinic 1 and 2. And that special clinic divides into the high risk patient who actually went to some other countries or in some zone that have the red zones or infected area. For example, in Thailand, because we went to a lot of Japan, everyone loves Japan mostly. So at that time that the outbreak comes and the Sapporo closed, shut down the whole town, actually Japan was like the person who comes back from Japan was actually on the high risk. So once we know that they came back from Japan, they'll be escorted to another zones and do the examination and check. Um, the other one that we did is we separate we did the service at home, which is actually for those who get scared or have like the old patient that needs high care, but one of the things is that they fear of coming to the hospitals. We reach them out by doing the service at home, and also with service at home, there will be some of the patient that get offended because we wear some PPE over there. So you will see like your neighbor will be quite, you know, you will be safe, you feel safe, but the neighbor feel really awkward to have somebody wearing the PPE and walk around, right?
True.
So so we do the telemedicine and telepharmacy on that one, and also we do the vaccination at home. We have saved a lot of lives, including a lot of the adult lives, where they sit at home and they feel sick or something like that. We send out the doctors and the nurse. Um, Apart from what we do in the ward, and we also turn our ward, one of the whole building and also the whole wings into the we call the hospital, and also the COVID ward, where now the COVID suspect be quarantined over there. And right now the whole ward, I mean the whole floor, are turned to be the negative pressure floor. So that's what we adopt into in order to protect and create a better patient experience.
That's some great initiatives that were taken at Bumrungrad, truly inspirational. And I'd like to, because you said that you had the facilities repurposed and redesigned to treat some of the vulnerable patients or some of the isolated patients. Now, those could be newborn babies or the old age group. How would you deal with the anxiety factor of the isolated patients when you put restrictions on visitation and there are visitation guidelines in place? So how do you
Mm.
deal with the anxiety that comes out in this case?
We had yeah, some of them got panic attack. Some of them feel like they being locked down and something like that. One of the key that the patient experience gave to the nursing and also the doctor's team is that what we work is we work together on communications. We always do the communications and we communicate to the patient directly. The office of patient experience, which I took care of, is actually we call the patient daily. We email, we send text message and something. It's we tried our best to engage them and to make sure that they are not alone. So we got some of the information. Sometimes it can turn from information to complaints. Sometimes it's from complaint to compliments, which actually that's our goal, to turn from noise to voice anyway. And of what we found, it's very interesting how uh, we convince the patient and we try to bring our best to them. Some of the patient got sick and they get scared, and some little things, little token of thoughts, for example, like a small, we have like the blanket shape, the ball shape blanket and something like that. So we send some of the souvenir and some of the smiley thoughts and some of the message. So this also happens when we do we implement the same thing into the alternative state quarantine and alternative hospital quarantine programs that we work with five-star hotels and also our own hospitals.
Interesting. I like what you said. You converted the noise into voice. That's a very positive perspective of it. And that takes me to the another question is patient experience will never be successful without the strong commitment to develop standards and processes to deliver frictionless care experience at every single touch point. What is the key strategy that your leadership team is focusing on to drive patient engagement in the current time?
Hmm. So we actually the first thing is we turn ourselves into the trendsetter because in the pandemic moments and also the patient experience when everyone has been quite panic and they want somebody to shine the lights on that and the guide way to do. So we created the guidelines on 10 measures or like 20 measures on how to do to prevent COVID. We sent out the like our marketing team, the chief marketing officer Kunapat, is actually launching out almost I think twice a week on how to take care of yourself during the COVID. How do you take care of the those who need help, or actually those, especially the aging people, those who have the kidney problems, have diabetes, what kind of food they need to order. Because in Bangkok and in Thailand, we usually order some food and like grab food panda or something like that. So to choose wise is one of the things. Choose right is one of the things. Choose wise is the other thing. So we actually set the trend on how to react with disease, how to clean the room, how to isolate yourself. And at that time, it was the home quarantine that being advised. So we also say if you need to do the quarantine at home or work from home, what kind of things to be concerned of, what kind of the laboratory you should look through, and also check yourself the psychological issue if you think that you may encounter to that one. Then the other one is we did the comfort support to those who care across the globe, because we are the international hospital. So our patient, I would say 50% of them are internationals, and they were very suffering on coming to Thailand, and because we shut down the countries, and also in the Middle East they also shut down the country, China, Myanmar, where it's our major place. They shut down the country. What we do is we try to comfort by using the telemedicine and also the medication delivery. So apart from coming, like we change our way of work by changing to telemedicine and telepharmacy. So they can consult with us, and what we do is we try to talk to them. We try to send them the medicine. We talk to the doctor. Uh, Thanks to the e-payment and everything that is ready inside. So we use all the technologies to make sure that we connect again with the patient, even though at the time of the pandemic. And the other one is the frequent communications to patients to ensure that they have the best outcomes. So what we do is that the clinic in Bumrungrad hospitals, all the nurses, they gather together and they set the squad to call out, to send out the WhatsApp message, and also some of the message to our patients one by one, and everyone revise all the information, and they talk, and we talk over like, would you like to talk with us on like some medicinal problems, or like your medicine should be end by this time, that time, according to our prescription. So we try to find our best where in their own countries that they can get the medicine as well. Because one of the best thing in Bumrungrad International is we give the international drugs. So the same drug can be bought anywhere in the world by using the generic name. Yeah.
Interesting. Great. I think flexibility is the key in the current time, and the
Yep.
willingness to adapt to the situation. Actually, I was reading the other day that almost, and I'm guess all who are watching or the viewers would be aware that almost 2 million people visit Bumrungrad International on
Yep.
an annual basis. That's a commendable figure. I'm sure the experience offered must be second to none, and the patient stories that are built in process must be truly incredible. I came across a recent video of a couple where husband was suffering from lung cancer during this health crisis, and how his only choice became his right choice by choosing to be operated in your facility. The story was extremely emotional, very extraordinary, and nothing less than miraculous. Bumrungrad did that miracle, which is absolutely fascinating. So, how do you choose the right stories, and how do you make sure that the process of telling and hearing that is beneficial to both provider and the patient?
Very, very good questions. Um, I think for us as the voice of customer and patient experience, the Office of Patient Experience take that all stories are very important. So we actually we hear all these stories, even it's good, which actually, if you turning into this position, it's not usually you get the good news, but
Exactly.
once you get the once you get the good news, it's very good news. And then the other one is we always take back on the story using the platform that we have the related management sectors to join in and hearing on what we heard. So it's not just one person shout out and there's nothing to come. Patient experience is very sticky on in terms that we are very hand on hand on what the patient say about us, and we would like to understand at first because when you work in the international settings there are cultural differences and also the diversity that you need to take care of, even like religious, even the other countries, how they thoughts and how and what is their background. So what we do is we have the monthly communication among teams, and we gathered around 100 managers together. Of course there will be some of the directors and C level to put together and having these comments, all the comments and all the sound that we heard sent out, and we have the measurement to take care of the key success that we propose the solution. So that's according to the patient needs. Sometimes when I mean, as the hospital administrator, sometimes when you know patient quite well, sometimes you overlook the patient. So this is we never get used to the normal norm. I would say the in keyword the normal norm of the patient. There's never been norm of the patient because one patient is individual, and they are very special in their terms. So at this one, we chose the right story by seeing the impact on how their life has been changed. So I would say all the stories are important, but once we chose the story, I think it's the life-changing story that we chose to inspire the others. And I think this is very important. It's not just only for our patients, but it for also for ourselves and also the hospital executive to think of why we are here and what kind of things we deliver to. So the value lays around the patient story, even it's the worst one ever. I also tell in the worst story to the management, and right at that time we will see how agile and how caring we were. So that was like the one that has coming out, and also this story, the one that you informed as well, that based on the real story, and we tried our best and we worked out. At first, the whole sky closed. Even you come from some countries in the eastern or in Europe where some are safe at that time, it's not possible to do so. We tried as fast as I can to get them, and at the end of the day, right now, he can have the normal life again. So
That's
I think that's our reward actually.
exactly. I mean, to be treated, to be given that gift of life in these difficult times, and the ray of hope that you can live back again is unmatchable. And I'm sure
Mm,
in the current time, it is difficult to tailor experiences for every single patient, keeping in
yeah.
mind their cultural background, different parameters that they come from, the religious backgrounds, also the medical
Mm,
history,
mm,
the geographical challenges. I'm
yeah.
sure I think in the current time, all healthcare providers are superheroes.
Mm, yeah.
That
And
actually,
then we also cherish our own team, even like the porter, the porter who actually, drive the wheelchair all around. They were very brave because they have to wear the N95 with some of the COVID positive patients. We support them, we treated them, and actually at first there's no good patient experience ever happen if the employee experience is bad.
Exactly. That's
Yeah.
the golden words. It's
Mm,
just not about patient experience, it's also clubbed with caregiver experience, and they are both
mm,
interlinked. Unless the employees or the carers themselves are
mm,
motivated, they're engaged, they're
mm,
empowered, unless that is taken care of, they won't be able to deliver the experience that the patients are looking forward to.
yeah.
Great. With that, I'd like to go to another question that we have for you is how do you measure success in layering digital strategy over patient experience strategy amidst the pandemic? How are you driving
Um,
technological innovation to amplify patient experience during the crisis time?
Mm. During the well, not just only during the pandemic, but in general, we have the Voice of Customer Center that has been set up last year, and we made the matter is to set up for the matter of care continuum. We have the international nurses inside the team, and they support the support team works daily to communicate and check on patients uh, prior to arrival, during the treatment, and also post discharge. So we make sure that all spans are okay. We have measure on the satisfaction score and also the NPS to make sure that it's okay. And by the result is right now we maintain the normal customer satisfactions. Uh, but for the telemedicine, we also have the press. So if you ask me on how we measure the success, I think one is how much we maintain the customer. The
Mm,
second one is the good story or the positive story behind it. So I would put on that one. And the other thing is how many lives we have saved. Apart from lacking of drug, we try to connect them into the medicinal or uh, medication supplies so that they get all of these things. Um, I don't know the answer, the correct answer on what measure. We have the NPS score, we have the loyalty score, but I don't think that one is worth more than that we maintain how many lives we have saved.
true. Agree to that. Thank you very much for taking that question. And uh, if I may ask, if you could redesign from a personal perspective, if you could redesign healthcare delivery, what key things would you like to change to transform patient view of the service experience?
Hmm. I would say we need to turn ourselves into food panda. I would say, but it's not the food panda. It's going to be the medicine panda. Uh, and then we should make sure that there's something that we can do the delivery in the redesign for the health redesign for the healthcare delivery. I would say that the light disease or like the small disease should be treated at home. And I think it's everyone would like it. I mean, everyone would like the world to surround you. And by the design of the technological designs, right now the world has been around you. For example, I'm not talking just only with Bumrungrad, but also in some hospital in Thailand, we also use the Bluetooth devices that we use to measure the blood sugar and something like all the things sent to the platform where our doctor can track, and also the blood pressure you can measure, and then you put it up to the Bluetooth. They will go to Wi-Fi. They will send back to our office and something like that, where we can trace on how they do. So this kind of the measurement doesn't need the patient to come to see the doctor anymore. But the thing is that you have to in the patient experience, the best service experience is that we need to be able to deploy that kind of service to them. And I think with the current platform, there will be coming the newer one, and I think the platform would be a lot better in terms. and I'm looking forward to do that. Whereas the advancement or in innovative hospitals have to treat those who in need of the physical treatment, for example, the knee replacement or some major surgical procedures, or even like the cancer treatment. So I mean, if the cancer treatment is about chemotherapy, where you need just only the pills or some of the infusion, I think that's okay to have the service at home. Yeah, but under the care of the doctors, like the doctor can live and see multiple monitors that we can see, whereas there are someone over there to take care of. And the other thing but what we have to do inside the hospital are those who really in need, so that you see that especially in Europe right now they have turned like into the emergency is emergency. If it's not that emergency, you wait for how many hours. Um, in Thailand, we cannot wait mostly, and I think that's why they fly to Thailand. We don't have to wait, and we have the care with it like almost if you wait just not than 15 minutes, because more than 15 minutes in especially in Bumrungrad we will be quite unhappy with that one. Yeah, so
Remarkable. That, that's
we
really
we
remarkable.
are yeah we are that strict, and of course there will be some of the case where we wait 2 3 hours, but that's maybe for laboratory or something that they need to be done. But what we can do is when we do the redesign, whatever can be done beforehand or just one day before, and it doesn't kill, for example, the laboratory result in like the glucose laboratory or hemoglobin A1C. For those chronic patients, they can do something at home, and we can serve them at home. And once they need to meet the doctor, for example, I'll put the diabetic as a sample. If you're being yourself as diabetic, you have to come to see the doctor, just only the eye doctor, because they need the equipment to see your eyes
Hmm.
and to make sure that you don't have the glaucoma. But the rest of it you can do at home. You
True.
can do
Yes.
the POCT glucose test. You can have the hemoglobin A1C by sending off the service at home. You can talk to the doctor, any doctor, anytime. Then you can measure the kidney functions by collecting 24 hours urine, see the creatinine and everything. Everything can be done at home, except you have to come to see the eyes and the physical examination at the extremities, where you will see that if there's any ganglion or any debris that you need to cut or something like that. That will be when you are turning to severe. Yeah, but in general, everything right now can be done at home. And I think the service redesign is that the healthcare for the general one or the preliminary chronic disease can be done at home, whereas the innovative design for the most those with complications
Yeah.
should be done inside the hospitals. Yeah.
True, and that is actually the future of healthcare that should look like, where in order to avoid the time-consuming activities and to be able to cater to the patients for more complicated procedures. Great. That takes me to the last question that we have for you. As a speaker at the Patient Experience and Engagement Summit coming up next month, what are you most looking forward to?
Well, I'm looking for as I'm also do the patient experience, and listening is actually my job right now. So I would like to share and also to exchange the knowledge of the patient experience around the world. And I would like to know more on how they react into the time of the pandemic like this. And actually right now I think it can be second wave in some place and the third wave in somewhere. But at the end of the day, we need to think on how to take care of our patient, because once they stamped to be our patient, I think borderless, and we shouldn't think that the hospital is only the barrier or the place where we count the patient as the patient. So
Exactly.
that's one of the things that we should be sharing with each other.
Great. It was Great inspirational talk we've had with you today. Thank you for joining us, and we look forward to hearing much more in detail from you at the Patient Experience and Engagement Summit next month. So similar to Bumrungrad, it is important for every responsible healthcare provider to make sure that their mission just doesn't end at the treatment, but holistic care. Powered by such inspirational stories emerging from the COVID-19 health crisis, the second annual Patient Experience and Engagement Summit next month brings a global perspective on new benchmarks for service delivery, exploring the intersection of operations, technology, and patient experience. This unique platform is the industry's voice for forging ahead in a new era. Thank you, Dr. Chatchai, and everyone for watching us today. We'll be back with another insightful session soon.
Thank you.
Thank you very much.